Today, we're digging into something pretty fascinating and, believe it or not, surprisingly serious: nocardiosis. Now, this is an infection caused by a bacterium that's literally all around us, in the very soil right under our feet. So how does something so common turn into a real threat? Let's get into it.
I mean, that sounds like something straight out of a sci-fi movie, right? A brain infection from dirt? But nope, it's a very real, though thankfully rare, possibility. And this question right here gets to the very heart of why we need to understand nocardiosis.
So, what exactly is this thing? Well, at its core, nocardiosis is an infection caused by a family of bacteria called Nocardia. Its most common targets are the lungs and the skin, but as you're about to see, it doesn't always stop there.
All right, to make sense of all this, here's our game plan. We'll start with what this bacteria even is, and then we'll figure out how it gets into the body. We'll look at who's most vulnerable, what warning signs to watch for, and finally, how modern medicine actually fights back.
Okay, first things first. Let's get to know our main character here, Nocardia bacteria. They're everywhere. They're found worldwide in soil, in water, you name it. And for most healthy people, they're completely harmless. But under the right or maybe wrong circumstances, they become what we call an opportunistic pathogen. They're basically just waiting for a chance to strike.
And what's interesting is that not all nocardia are created equal. The two main types that usually cause problems in people kind of have their own specialties. Nocardia asteroides is the usual suspect behind lung infections that can then spread all over the body. On the other hand, N. brasiliensis is more often the one that causes skin infections, especially in warmer, tropical parts of the world.
Okay, so if this bacteria is just hanging out in the soil, how on earth does it make the jump into a person? Well, it turns out there are two main ways it can get in.
So, the first route is through the air. You could be gardening, maybe working at a construction site. You kick up some dust, and without knowing it, you breathe in the bacteria. That's how most lung infections get started. The second route is direct contact. Let's say you have a little cut or a scrape, and it gets some contaminated soil or water in it. Well, that's an open door for the bacteria to get in and set up a skin infection. Now here's a really important point, so listen up. You don't have to worry about catching nocardiosis from someone who has it. This isn't contagious like the flu. It's an environmental infection. Your exposure comes from the world around you, not from other people.
So that brings us to the big question. If this bacteria is everywhere, why isn't everyone getting sick all the time? And the answer really all comes down to your immune system. Nocardiosis is an opportunist. It waits for our body's defenses to be down. And this list really paints a clear picture of who's most vulnerable. We're talking about people who've had an organ transplant, those going through certain cancer treatments, or folks on high-dose steroids. Conditions like advanced HIV, diabetes, or even chronic lung disease can also weaken the immune system, making it easier for an infection like this to take hold. But here's where it gets a little wild, and honestly, it's something of a mystery for doctors. A full 40%, that's almost half, of people who get nocardiosis have no known pre-existing condition that would put them at risk. It's a huge reminder that while we know a lot, we're still learning why this can sometimes affect perfectly healthy people. Now, to put this all in perspective, let's be clear. Nocardiosis is rare. In a massive country like the United States, we're only talking about an estimated 500 to 1,000 new cases each year. So yes, it's serious, but no, it's not common.
Okay, let's shift gears and talk about what this infection actually looks and feels like. The symptoms totally depend on where the bacteria decides to set up shop in the body.
So if it's in the lungs, the symptoms can be pretty vague. Things like a cough that just won't go away, fever, chest pain, and maybe some weight loss. But for a skin infection, it's a lot more obvious. You might see these firm, red, painful abscesses or lumps that can eventually start draining pus.
And this is where nocardiosis can become truly life-threatening. The bacteria can actually travel from where it started, often the lungs, through the bloodstream to infect pretty much any organ. And its most common and most dangerous destination is the brain.
And you have to see this statistic. In up to half of all cases where the infection spreads, it goes to the brain, forming abscesses. That's a true medical emergency. We're talking severe headaches, confusion, even seizures. This is exactly why getting diagnosed early is so incredibly important.
So, how do doctors figure out that this specific rare bacteria is the culprit? And what can they even do about it? Well, the medical response is a careful, step-by-step process.
Diagnosing this is like medical detective work. Doctors will take a sample of tissue or fluid from the infected spot.
Then they might look for the bacteria's unique shape under a microscope, but more often, they'll culture it. That means they put the sample in a special lab dish to let the Nocardia bacteria grow, which is the surest way to confirm its identity. Once it's confirmed, the main weapon in the arsenal is antibiotics. But listen, we are not talking about a quick one-week course here. Treatment is long-term, often lasting from 6 months to a whole year, just to make sure every last bit of this tough bacteria is gone. A common choice is a combination drug called sulfamethoxazole/trimetomifram.
And for the really severe cases, say in someone with a very weak immune system, or if the infection has spread all over, doctors will usually add a second antibiotic into the mix. Plus, if abscesses have formed, especially in the skin or the brain, surgery is often needed to go in, drain them out, and clean up the infected tissue.
Finally, let's bring it all home. What's the outlook for someone diagnosed with nocardiosis? And what are the biggest takeaways we should all remember from this?
The outlook, or prognosis, really depends on the type of infection and, crucially, how fast it gets treated. It's almost a tale of two outcomes. Most skin infections, they clear up really well with antibiotics. But a lung infection, or any infection that's spread and is left untreated, well, that can absolutely be fatal. It just shows how critical it is to get medical help for symptoms that don't go away.
So we end on this thought. This bacteria, Nocardia, is just a quiet, constant part of our world. The fact that it can cause such a serious disease is a powerful lesson in just how critical our immune system is, working day in and day out to protect us from countless threats we never even see. I really hope this explainer gave you a clear picture of what nocardiosis is all about. If you found it helpful, do me a favor and hit that like button. Share it with someone you think would be interested, and of course, subscribe to the MediByte channel for more deep dives into medical topics just like this. Thanks so much for watching.